Historically in this country, we have disinvested in communities, particularly communities of color, to the point that health inequities exist across our country, particularly around issues of race. We have to address it head on that racism in this country is a public health crisis.
All of us share that COVID has affected us, but it's not shared equally. Our brown and black and immigrant communities carried this burden even more so.
People of color are more likely to work in jobs deemed essential, so going to work every day. When you line those pieces up, you have people that have less access to healthcare, required to go to jobs that give them more access to the coronavirus, with less opportunity to access healthcare. Our team jumped in really trying to figure out how do we help.
Responding quickly, that was the name of the game for us here. Our team did an amazing job of coming together. We knew that testing needed to be available for our vulnerable communities.
We interact with so many different people that when you have a segment of the population that can't access care or is more likely to be challenged by a health pandemic, it puts all of us at greater risk if we can't take care of everyone. In a situation like this, we need everyone to be able to get to a doctor, to get tested, to be able to step away from work to take care of the need they have.
We have individuals that speak Spanish. We have individuals from the African American community. We are able to use interpreters. So we just want to do everything that we can to build that sense of comfort, to build that sense of trust with the communities that we're serving.
One of the things that we've seen in Wyandotte County is people unwilling to get tested because they don't want to know the result. Because the result will mean they can't go to work. The result will mean they may have to go to the hospital. They can't afford to go to the hospital. And those barriers is what Vibrant Health's trying to work against. Our mission is really built in the idea that people have a right to health care, all people.
Well, in terms of health conditions and outcomes, Wyandotte County has been at the bottom 2 of 105 counties in Kansas for health outcomes and poor health conditions. Not only the health conditions, but housing issues, employment issues, educational issues with the school system. The need is great.
About 20 years ago, I was living in Johnson County and there was nothing available for me in Johnson County, but somebody told me about this little clinic in Wyandotte that had a sliding scale. I called them, they made an appointment with me, they assured me that it would only be $25. That was amazing.
One of the differentiators between us and other healthcare providers like us is the staff team that we have.
I mean, the mission of Vibrant Health is respectful care, culturally sensitive care, high quality care, and even most important, empowering care.
One of the things my advanced practice nurse tapped into immediately was that I might need someone to talk to. And so she got me counseling services. It was holistic, it was the whole body, it was that you really matter.
We have a passionate staff that care about families, and what they value about coming to work every day is that they get to know the families we work with.
After about 10 years of being a patient, I decided to quit my job, which was an hourly job with no benefits, not even sick time, and go to school and become a nurse because it seemed like a good thing to do, and I had been treated well by people, and it was a concern of mine that people weren't getting the attention they needed or even the consideration.
Everybody deserves access to great health care and respect, treated in their language, in the way they want to be treated, so they feel welcome and respected when they walk into our facilities.
It was a huge influence that not only I could make a difference for myself and my daughter, but I could make a difference for other people. And I had never thought about being a nurse prior to that, never. I have been a part of this healthcare system for over 20 years, and I wouldn't go anywhere else.
We are capable of far more than we think we are. And there are a number of things we've put together, telemedicine being one.
We definitely have patients that benefit from it. So our team went out and delivered those packages right to their door so that they could get everything they needed to be able to participate in a telehealth visit with us and stay safe in their home while we were still treating them.
Once we knew that COVID-19 was going to last here for a while, we were very concerned because she is very susceptible because of her age.
Para mí fue una bendición porque no tuve que salir de la casa. La doctora me recibió muy bien por el teléfono, yo también porque me da gozo verla cada vez que la veo. Me estuvo haciendo mi consulta como si estuviéramos en la clínica.
It's a great relief to know that they could connect through the phone. And then once she was done with the appointment, she went back to doing whatever she was doing at home.
These are our sisters, our brothers, our neighbors, our children. I don't want to think about if we weren't here, really.
For Vibrant Health to pursue its mission fully, we have to acknowledge the systemic racism that exists in our country.
COVID has opened the doors for us to recognize the racial disparities and inequities that exist. And when you combine that with the racism that is now visible, you have to feel in your heart that you want to do something.
With Vibrant Health being a federally qualified health center, we will see more and more community members that are dealing with the unemployment, the emotional distress that has come out of COVID-19.
Vibrant Health is still working through an expected $1 million shortfall in patient revenue. We are anticipating the need for more staff to see the same number of patients due to increased workflow requirements with COVID-19.
I think the new normal for Vibrant Health is to open our doors even wider.
So we've created this campaign, A Vital Need for Vibrant Health, to finish the year strong and to ask for your support.
Thank you for caring. This is a population that we serve, but we're all in this together.
I believe that when a human being is treated as though they matter, they begin to believe they matter. And that has to have had an effect on where my life went. Just a little bit of value and worth given to a person who's not received that before can make a huge difference.
We plan to be here to continue the good work that we do.